So you've broken a bone or had a fracture. Here's what you need to know and a little bit of what you might like to know. So in the emergency room, after you've initially broken the bone, we put a splint, not a full cast on the broken bone. This is because initially you may get quite a lot of swelling. If you have a full cast all the way around the arm or all the way around the leg, then it can cut off the circulation when you swell. If we only have half a cast, that won't happen. The other nice thing about a splint is that it holds together the bones the same way that a cast would while allowing for swelling. So now the bones can heal. If they're always apart and moving and shifting, then they're never going to heal together properly. So it holds the bones together, and it also provides you with quite a lot of comfort. It doesn't hurt so much when the bones aren't shifting. As well, you can also take ibuprofen, which is the same thing as Advil or Motrin, or Tylenol for pain if you like. Now the most important thing you can do to speed up your healing is to keep the limb that's broken elevated. So if it's your arm, keep it elevated up so the gravity is pulling swelling away from the broken bone. If it's your leg, it needs to stay up on another chair when you're sitting down or on a pillow when you're sleeping. Now Raymond is demonstrating a sling here for us where the arm is actually going down. A lot of patients do this when they have a broken arm and they have their splint on and then the arm goes downwards, so gravity is pulling it towards this swollen area. We went to have this a little bit tighter and higher so that gravity is pulling the swelling away from the area, and that way it can heal faster. So make sure you have your sling on properly, or any other kind of sling that you're using, that it's attached properly so that it's not dangling downward but up. And do feel free to take your arm out of this sling. The sling is really just a reminder to you to keep your arm up and not let it dangle down so that all the gravity is pulling the swelling down to where your broken arm or broken bone is. You want to keep your arm up as much as possible, so if you can remember, you can take it out of the sling, pretend you're the queen and you're doing your wave, keep it up as much as possible, put your elbow on the table, this is the one time you can do it, to try and get that swelling away. Again, this is just to remind you to keep your arm up. You can take it out of the sling, but don't let your arm dangle down. Now, if you were put in a full cast, which goes all the way around, and you find that your fingers are going numb, you have pins and needles, or your fingers are going blue, that means that you have cut off the circulation. Maybe you let your arm dangle down too much and there's a lot of swelling, or there just was going to be a lot of swelling, and now the circulation's cut off. In that instance, when you have the full cast, you need to come back to the emergency room. We will cut off or cut open that cast to allow more space for the swelling and to get more blood supply back to your fingers. It happens only very rarely with a splint because the splint allows for more swelling to occur. The only time that might occur is if around your splint a compression bandage like a tensor was put around it. If the tensor is too tight, it can cause you to cut off your circulation. And you can actually try and pull it off. It will come off. It sticks a bit to the plaster, but you can pull it off and then re-put it on less tightly so that way your fingers can feel better. So do keep an eye out for that if a tensor was used. Cling and regular cotton won't do that. So in general at Sunnybrook, we never use tensor to wrap our splints for that very reason. Now do remember to keep your plaster or fiberglass splint dry. You will regret it if you get it wet. Do not get it wet at all. Wrap it in a plastic bag if you're going in the shower because it will smell really bad and it will fall apart. So you should not get it wet. Do keep it dry. If you have a leg fracture, you should be fitted for crutches properly and you should use them. Don't cheat. Don't put a little bit of weight on that cast. That's not what it's meant for, and you will just hurt yourself in the long run. You'll also damage your cast. I'm Dr. Atzema, and those are my discharge instructions for a broken bone with splint.